So hello, everybody. My name is Aaron Rosenblum. I'm a medical student in the class of 2022 at the University of Minnesota. I'm here today with Ricardo Levins Morales, who is a Minneapolis-based artist and organizer and a member of the organization MPD150. We're going to be having a conversation about creating community safety beyond policing. And this conversation is a part of the Twin Cities Medical Society's Community Conversation series. So welcome, Ricardo. Thank you for being here with us today.
Indeed.
So just to kick it off, I think some of our listeners may have heard of MPD150, but for others this will be new, a new organization. Can you provide a little bit of background about MPD150, how the organization came to be, and what the mission is of the organization?
Sure. Well, MPD150 began in early 2016, and it was sparked by the realization that the Minneapolis Police Department would be celebrating its 150th anniversary the following year, or at least marking that time. They actually didn't celebrate. And we thought it was maybe a good opportunity to do a community-based performance review of the department. This is sort of coming on the heels of the police killings of Jamar Clark, Terrence Franklin, and others. And we knew that after each of these police atrocities, you would have a community rising up in protest and demanding a series of reforms that have sort of been cycled through over the last 100 years. And we wanted to look at that history and see why is it that we keep demanding the same things and they keep not making any difference. So we created, with volunteer community teams of artists, activists, organizers, and researchers, we investigated the 150 years of history. We also had an interview team that spoke with social workers, people working in domestic violence, in the schools, sexual violence, and so forth, to find out what their present day experience was interfacing with the police. We partnered with a team of Northside high schoolers who had done street interviews around people's experiences with the police. And then we researched what alternatives either exist or could exist to replace the functions of the police. We issued a report in 2017 and have since done zines, audiobooks, teaching in classrooms, media work. We have a comic book out on the history of what they call community policing. So it really, our function was to shift the narrative around policing and open up the imagination to consider that perhaps this institution, which was really consolidated in the wake of the Civil War to keep Black people in an underclass position, that might not be the solution that we look for if we were to simply think, well, what does our community need to be safe, to be resourced, and so forth.
Yeah, thank you. And that's a perfect segue to the next question. I'm sure that you have heard, and other members of MPD 150 have heard, concerns around, well, if you get rid of the police, there's going to be violence in the streets and chaos. And also kind of the expectation that, we want safety in our community and that police are the ones who, work to maintain that. They're the arm of the government that maintain that public safety. So in the context of defunding the police or changing policing as we know it, can you talk about kind of what does it look like in practice to replace that institution and still have that community safety, that public safety?
Sure. Well, let me just start by saying that this is why we research the past so seriously, that in order to think about whether or not to replace them, we have to look at the track record of what they do and what they are, to what degree they perform safety. What you describe as high crime, violence, and chaos, actually that describes the reality in the United States and has for a long time. And it's often a function of extreme inequality, under-resourcing of communities, and the police are there to kind of manage those boundaries and keep people in their place. When we look at what are the functions that the police actually play, or what do they supposedly play, And we've done this in workshops where we have people brainstorming, what is it that the police are supposed to be there for? How many of those functions do they actually perform well? And we find that they don't do very many of them very well, other than the function of racial profiling. So even when we consider them to be law enforcement, for example, a function like preventing people from speeding, who do they stop? So what looks on the surface like law enforcement turns out to be racial profiling, which is essentially a crime. So that we have to question what is the degree of safety. Now, the other side of the question actually illustrates the nature of the problem, and that's the question of who do you call. The fact that there's nobody else to call is the problem. So we have to call, especially in dark communities, call people who might show up and kill your loved one, who might have been abusing you, but you don't want them dead, right? Or in cases of mental health crises, you have people fresh off of these mental health trainings, supposedly, who come in and they find somebody in crisis. Maybe they're holding a kitchen knife, and the strategy is to point guns at them and scream. And then they say, well, we had to kill them because they weren't following instructions. I mean, who in a moment of emotional and mental crisis will even understand what instructions are being screamed at them? So those are part of the problem. I come from Puerto Rico, okay? And a couple of years ago, we went through Hurricane Maria. And in the response, who can bring in supplies? Actually, the only institution that was able to do so was the U.S. military. Does that mean that we need the U.S. military to fulfill that function? Or is that a sign that resources have been monopolized in such a way that we feel dependent on them? So if we think about that question of, well, what is community safety? What does that mean? What does that look like? And of course, a lot of it has to do with deprivation. The crises, both emotional crises and the financial crises that come from the stresses of simply not having what you need to live on and having under-resourced, polluted, et cetera, communities, underemployed. But even when we address those, there's always going to be a degree of acute crises that we have to figure out how to deal with, right? Well, it turns out that there are many professions that have to deal with people who are out of control and people who are acting in violent ways. I've talked to people who work in centers for youth with mental and emotional disabilities, right? Who might be hefty young men who are behaving in violent ways, and they figure out ways to de-escalate without killing them, right? Or brutalizing them. And certainly, I, for one, I can't speak for everybody involved in this work, I, for one, understand that sometimes there are situations that you need to be able to use more skillful and superior force to be able to bring under control. It's unfortunate, but those should be carried out by people whose fundamental training is in de-escalating and helping people and only resort to weapons when absolutely necessary. It's not that hard to come up with these solutions once you decide that the institution we have is not viable. Then you have to start thinking, okay, well, what are the ways in which we can do this better? Actually, almost anything would be better. There was a case I heard of in Chicago where a young, Black, of course, autistic boy was having, acting out in the basement in ways that freaked out his parents. They called the police to intervene. The police had been to that house before. They knew this kid. They walked into the basement and shot him to death. The mother had been particularly frightened at the idea of having to call the cops, but their insurance policy would only cover treatment after an outbreak like that if there was a police report. Without the police report, the insurance wouldn't cover it. So you have all these ways that force a dependence on an institution whose fundamental core functions are actually not very good for us. So the secondary functions, a lot of the social service functions, for example, have been acquired by the police in times when they needed to improve their image. And if you talk to people involved in responding to domestic violence calls, when they have the police riding along with them, the situation becomes escalated. In women's shelters, they say, no, our clients do not like it when the police show up, because in the interviewing, they're often asking, well, what were you wearing? What were you doing that brought this attack on, right? So it's not hard to think about, well, what would be a right way to do this? And all efforts to turn the police into that instrument have failed.
Right. Yeah. Time to try something different.
Right. And I think my main point is that, as with anything, once we break our imagination free from this learned helplessness and this learned dependence, it's not hard to think of creative solutions.
Yeah, absolutely. Thank you. So the next question is kind of as a way to appeal to the physician and the scientist kind of audience. These are people who, generally speaking, they're like, show me the data. What does the research say? Where's the evidence? And even though, you know, we have some practices in medicine that are more based on tradition than data, you know, there's at least an ethic that tries to be aware of that and be open to change and openness to new discovery and new findings. So with that in mind, you know, what, in terms of the research that MPD150 has done, what data or evidence has been uncovered to say, like you've been saying, this policing as we know it is not effective, and some of these other alternatives could be or are already in some cases more effective?
Right. Well, there are other researchers on our team who'd be better qualified in terms of some of those specific answers, because I didn't come prepared with footnotes.
Yeah.
You know,
right.
But what I can do is answer, you know, sort of generalize about some studies that I have been exposed to that show that the rate of crime does not correlate to the number of police. That increases in the police force do not lower crime, decreases do not inherently raise crime. Also, I also want to approach it, and this is very relevant to public health, that when we look at it from a qualitative or a strategic perspective, there are really two approaches to public health. They're not mutually exclusive, but they're often treated that way, and those are a horizontal versus a vertical approach. Okay, so a horizontal approach says, in order to guard against and sort of prevent outbreaks and pandemics and ill health, you raise the immune capacity and the resilience of an entire population. That means they're well-resourced, they have food that's healthy for them, they have exercise, they have a sense of agency, all the things that make us vibrant and resilient. That's a horizontal strategy. A vertical strategy is, we will identify a specific pathogen, we will look at what is causing, in a very narrow sense, an illness, and we will develop a medicine that will intervene in that. You know, right? So that, for example, if you're dealing with dysentery in Bogota, the horizontal approach would be, we've got to clean up the water. You know, the water is polluted, unhealthy, and full of bacteria. A vertical approach would be, we need to intervene with particular medicines. Now, our system, both in terms of social change, in terms of social services, in terms of medicine, is very heavily tilted toward the vertical.
Right.
Right? So that, you know, when we look at problems ranging from mental health to various forms of physical health, if you deal with the source of a problem, of course, that is more effective in the long term than simply responding to the injury or the expression of the injury, right?
Yeah.
And so the question is, well, how can we take that knowledge and turn that into policy? And there's no question that we need vertical interventions. But within the context of horizontal resourcing, then we have a much better chance, and those interventions can be very targeted. The problem is that we have a hard time correlating or reconciling, I should say, a horizontal strategy with capitalism. So that in Chile, for example, in the 1970s, the president of Chile was a man named Salvador Allende, who was a medical doctor. In previous times, he had been the health commissioner. Before that, he'd been a doctor. And he became involved in politics, realizing that the health issues that were impacting the Chilean people really needed to be addressed at an environmental level. So they did many kinds of interventions, including, for example, building codes that were resistant to earthquakes. So when Chile and Haiti experienced earthquakes at the same time, there were a number of factors involved in where was the epicenter and so forth. But one of the factors that allowed Chile to have very, very few casualties whereas Haiti had hundreds of thousands, was that the buildings that had been constructed during the time of Allende with those health codes were meant to resist earthquakes, whereas the construction industry and the developers were very hostile to those reforms, and they had them reversed after the Pinochet dictatorship came in. So you have all these different levels and factors playing in. The police, in fact, are meant to be a vertical intervention.
Right.
Well, actually, they're a little bit of both, because they intervene in conditions of a particular criminal incident, for example, but they also intervene on a general systemic level, the continual harassment of Black people, the fact that an African American or a Native person, especially a young person leaving home, has to be very aware if they're going to run, ride their bike, interact with white people, that any of those incidences can result in tremendous consequences, right? Yeah. And the police role in systemic racism goes way beyond the beating people up and killing people. Those are what you call lower medium frequency, high impact. But you have those high frequency, low impact, constant incidents that erode one's sense of self, that debilitate the nervous system, what they call in psychoanalysis weathering. That means that people in certain populations have a higher cortisol activation in their bodies, and a higher systemic inflammation, and so all of these factors play in, and the police have from their foundation been instituted as a system of sort of marking those boundaries. And to be specific, when emancipation freed slaves from chattel slavery, and you had the struggle over Reconstruction, the way in which the Southern system decided to keep Blacks from actually achieving equality and being able to compete with whites was through criminalization. First with what they call the Black laws or the Black codes, which could sweep up any Black person and criminalize them because that's the way they were constructed. Once they were convicted, that made them ineligible to access to credit for land ownership, to serving on juries, to voting, to many forms of employment, and so forth, so that those preserves could be reserved for white people. And the genius of the system is that this is invisible to white people, who simply think, well, these folks are criminal. And that is the system that we still have now, that you have a guaranteed support base for the police in a large part of the white population who understands that they're threatened when a poor Black person breaks into their home to get something that they've been denied. They understand that Black people are in the prison population in vast numbers, and assume that that means that they're criminal, and therefore we need actually to continue funding, increasing the support for the police, and it becomes a self-perpetuating system.
Right. Yeah, thank you. And I think you really spoke to, how this affects the public health. From a public health standpoint, you're not addressing the underlying issues by continuing to fund the police and build up that apparatus.
Right, and it's one of those complex interfaces between systemic racism, structural racism, and internalized ideological racism. The fact that so many medical professionals believe that Black people are more resistant to pain and therefore need less pain relief, right? You have all of these kinds of things that we absorb and act on in unconscious ways. The idea that a Black person is more likely to be hypochondriac, right? The symptoms aren't really particularly severe, so we don't need to do anything. There's a lot of these ways in which it filters in to our own behaviors.
Yeah, absolutely. Well, thanks. This has been really great. I think we're about at 20 minutes, but I'd just like to give you one last opportunity. So, as you know, the audience for this is going to be physicians, future physicians. Do you have any specific message that you would want to share with that group of people And for those who this is really resonating with, how can they plug in and support the work that you and the MPD150 are doing?
Yeah, well, on our website, we actually have lists of resources, other organizations, where people can plug in and support in various ways. Certainly, there's the self-transformation required so that we can serve the communities that we're meant to serve. And also, when it comes to medical practice, I think it's that question of when people show up in your office week after week, showing the same symptoms and carrying the same pathogens or injuries to their system. At what point do you ask, where are these injuries coming from? How do we intervene on another level? It's the same way of thinking about the body, that at a certain point you might have to look at, well, what is the level of systemic inflammation in this body that's making them susceptible to all of these different expressions? And society works very much the same way. And I would say that as an organizer, I would describe hopelessness and despair and deprivation as the underlying condition, the systemic inflammation of our society. And when you start intervening on those levels, you begin to be labeled as political. When you say, why is the water polluted, rather than what is the pathogen that's causing dysentery, then that means you're stepping into territory where you might be walking into trouble, but that's because you're actually getting closer to the answers that matter most.
That's great. Thank you so much, Ricardo.
Well, thank you. A pleasure. And a greeting to all of the physicians and students out there.
Yeah, thank you.